Thank you. Margarita De La Garza-Graham. I was trained as a general and a trauma surgeon. I've been in general surgery practice almost 25 years, and I still teach ATLS, trauma life support. I was born and raised in a border town, the third of 10 children. Most of my family still lives in a border town, and I have quite a bit of first-hand information in addition to what I see in my practice and having spoken to infectious disease colleagues of mine. This is a public health problem, and what is happening in the border is terribly troubling from a medical standpoint. You just can't have mass immigration into a country without having anybody check the health status of every single person entering the country. When we travel abroad, we have to be vaccinated against many diseases that this country doesn't have anymore. By the same token, anybody that comes from another country to immigrate into this country has a whole slew of tests, physicals, health examinations done before they actually enter into our country. So really it's very irresponsible, medically irresponsible for us to allow this mass migration of folks without actually checking them. And then allowing them to go to every corner of the United States where we know have gone to Maryland, and Georgia, Arizona, California. They're going in every direction, and we don't even know the names. We don't answer simple questions, even have you had weight loss recently? Have you had a fever recently? A cough, a recent cough. And I know that these folks are traveling in buses, private buses, and trains, and planes, and nobody is following these kids. Now, our social workers are very good at tracking TB patients. I'm talking about TB right now, but that's not the only problem. TB is very difficult. It only takes one person to infect a huge, it's a trickle-down effect. If you have one active case of TB, in fact, I do know personally an officer on the border who contracted TB and then took it home, and now his son is sick. So I know these are firsthand accounts of some of the things that have occurred. TB is difficult to trace. It's very difficult to trace, and even with the technology. But it's even more difficult to trace if we don't even know who has it. That's not the only problem TB. We're having a problem with whooping cough, and scabies, and HIV, and hepatitis A, B, and C. Some of these that are highly contagious problems. Those in our community that are the most vulnerable are our elderly, our children, our own children, our schools. But then also you have the teachers, the social workers, and the list goes on and on. All of those of our patients who are already immunocompromised with either HIV or with any leukemias, anybody who's already immunocompromised. And then law enforcement, of course. A smaller percent, I think they've already mentioned the numbers, are children. I know firsthand also that we have actually processed MS-13 teenagers and young men. They are the recruitments and they are the reinforcements for the gangs who are already here. That's a whole other separate medical problem when it comes to trauma, because we know that's going to be up and coming. So that's something that hasn't been addressed either. And maybe that is the reason they did not want to have media on the border early on. I don't know why they didn't have folks, and maybe because there are a large amount of older teenagers who knows if they're immunized, who knows what disease they get, nobody really knows. I mentioned whooping cough. We already have a problem in the United States. We didn't have to have this mass immigration for that problem because a lot of folks here choose not to immunize their own children. So we have this thing called herd immunization, HERD when you herd, and all of those of us who did get immunized and protected the rest of the community. Even that immunization is going away because so many people have not immunized. And there are strains now that are coming out. The vaccines that we currently have aren't even strong enough because we have kids documented who have been vaccinated as children for the whooping cough, which is pertussis, who are actively contracting whooping cough. We're just not making strong enough strains. Anyway, I think everyone is overwhelmed. Our medical leaders have asked for volunteers from healthcare professionals and nurses. And there just aren't enough of us to volunteer to try and take care of the situation. Finally, I think that I would end by saying, I guess if I had a take-home message, it would be, don't be shocked if in 2 or 3 years we have an overwhelming problem with tuberculosis. We already have a problem in our jails, we know that. And it would be devastating to our whole community.